medical and scientific community like this. So let me just get the... Thank you, sorry. So the title of our study is Commonly Occurring Bacterial Pathogens in 2014 and Antimicrobial Susceptibility Patterns and Trends for the year 2012 to 2014 at the Philippine Orthopedic Center. In the interest of transparency and to help form your own judgments of potential bias, we declare no conflict of interest. So my discussion will proceed as follows, so let's get the ball rolling. As we all know, antibiotic resistance has been called one of the world's most pressing public health problems, and customary routine of indiscriminate or extensive use of broad-spectrum antimicrobial agents has largely contributed to this problem. So as nurse researchers at the Philippine Orthopedic Center, we realized that there were no surveillance studies that were developed in our institution to monitor clinical isolates of bacterial pathogens and their antimicrobial susceptibility rates. It is significant to have information on the bacteriological profile of the hospital to guide the modification of drug regimen strategy as well as to foster rational antibiotic use that will be an important step in formulating infection control guidelines. Resistance can be reduced if the empirical treatment is based on hard and updated evidence tailored to the unique environment of our hospital. The general objectives of the study is to determine the frequency distribution of the commonly occurring bacterial pathogens in the hospital for the year 2014 and to identify susceptibility patterns and trends to antimicrobial agents of these pathogens for the year 2012 to 2014. Specifically, to distinguish the occurrences of these pathogens for the year 2014 in terms of the body site from which the organism was isolated and clinical and special areas of the hospital. To determine the antimicrobial susceptibility patterns of the bacterial pathogens for the year 2012 to 2014 and to illustrate the trend of antimicrobial susceptibility of these pathogens to antimicrobial agents for the 3-year period. This quantitative and descriptive study was conducted at POC last February to December 2015. So the inclusion criteria are the following: laboratory records of different types of specimens from all inpatient and outpatient subjects submitted to our lab for culture and sensitivity testing from January 2012 to December 2014. So this study included different types of specimen like blood, wound, cerebrospinal fluid, soft tissue, bone, joint, urinary tract, and respiratory tract. The exclusion criteria are the following: data from patients from different institutions, specimen not examined in our lab, laboratory results such as please correlate clinically and please send another specimen, other types of tests that are beyond the capability of our laboratory. So the results of the culture and sensitivity testing were encoded in a standard data collection template containing patients' clinical demographic details. Presenting clinical history and underlying illness were also noted wherever applicable. Data were collated and tabulated for statistical analysis using EpiInfo version 7. So let us now take a look at the data collection flow chart. The total number of specimens sent to the lab for culture and sensitivity testing that were assessed for eligibility was 3,929, and more than half of this had no growth. This result may indicate true negative growth or might be due to sampling errors or conditions during specimen collection and handling. The study revealed that most of the bacterial pathogens in this institution were gram-negative bacteria. The leading gram-negative bacterial pathogens were Enterobacter species and Proteus species, and the most common gram-positive species was Staphylococcus aureus. This study showed that the most commonly occurring bacterial pathogens came from the respiratory tract, which included the following: Enterobacter species, Pseudomonas aeruginosa, and Pseudomonas species. From urine, which included Escherichia coli and Enterobacter species, and from wound, which included Enterobacter species, Staphylococcus aureus, and Proteus species. Similarly, a study at a local hospital revealed that their most commonly occurring bacterial pathogen, which is Enterobacter, also came from the respiratory tract, urinary tract, and surgical site. So as you see in this table, the most commonly occurring bacterial pathogens came from the spinal rehabilitation ward, which included Enterobacter, Proteus species, and E. coli, and from observation unit, which included Enterobacter species, E. coli, Proteus species, and Pseudomonas aeruginosa. The spinal rehabilitation ward had the most distribution because patients admitted in this area are those that require long and repeated hospital stays. These patients usually possess neurogenic bladder and suffer from frequent episodes of UTI caused by urinary stasis and frequent catheterization. Moreover, skin breakdown, immobility, infection of pressure sores, fecal contamination, paralytic illness, and an abnormal state of consciousness caused by associated head injury can predispose patients to aspiration pneumonia, infection of pressure sores, and others, which result to a higher rate of hospital-acquired infections than the other groups of patients. The observation unit ranked as second, and patients admitted here are those who had been evaluated to be critically ill, deteriorating, and needs close monitoring, in respiratory distress, with different contraptions like endotracheal tubes, mechanical ventilators, nasogastric tube, and chest tube. So these considerations may have contributed to the increased occurrence of bacterial pathogens as compared to the other areas of our hospital. Now let's take a look at the antimicrobial susceptibility patterns and trends of the top 3 pathogens for the year 2012 to 2014, which include Enterobacter species, Proteus species, and Staphylococcus aureus. So please note that the isolates were classified as susceptible, intermediate, or resistant according to the breakpoints established by the Clinical and Laboratory Standards Institute. As you can see in this graph, there was a remarkable decrease in susceptibility of Enterobacter species to amoxicillin clavulanic acid from 2012 to 2014. Other active agents that remained consistently effective against this species for 3 years were cefepime, natilmicin, amikacin, nitrofurantoin, ceftazidime, ciprofloxacin, and ceftriaxone. This graph shows the susceptibility profile of Proteus species for the 3-year period. So as you can see, it remains steady for most agents, most especially cefepime, amikacin, and ceftazidime. The graph also shows a decrease in susceptibility against cefazolin and amoxicillin clavulanic acid from 2012 to 2014. Since the susceptibility profile of this species remains steady for most agents, continued utilization of most of the antibiotics that are being used against it is possible except for cephalexin and cefazolin. So as you can see in this graph, the antimicrobial susceptibility of Staphylococcus aureus to vancomycin and gentamicin remains steady for the study period. It is also significant to note that the decrease in susceptibility of this species to nitrofurantoin for the year 2012 and 2013, and the sudden increase in susceptibility in 2014. Also, its susceptibility against oxacillin decreased for the 3-year period. So just to recap, the frequency distribution of the existing bacterial pathogens in the hospital for the year 2014 was identified, and the susceptibility patterns and trends to antimicrobial agents for 3 consecutive years were analyzed. Gram-negative Enterobacter species and Proteus species were highly susceptible to cefepime, amikacin, and ceftazidime, and gram-positive Staphylococcus aureus was highly susceptible to vancomycin, amoxicillin clavulanic acid, and gentamicin. So in conclusion, the study revealed that gram-negative bacterial pathogens are the most commonly occurring in this institution, and the leading pathogens were Enterobacter species and Proteus species, which were most susceptible to cefepime, ceftazidime, and amikacin. The most common gram-positive species was Staphylococcus aureus, which was most susceptible to vancomycin, amoxicillin clavulanic acid, and gentamicin. So most of the bacterial pathogens were from the respiratory tract, urine, and wound. And the clinical and special areas where most of the bacterial pathogens were obtained came from spinal rehabilitation ward and observation unit. Let me just mention that this research endeavor was funded by the Philippine Orthopedic Center, and we want to thank the following individuals. That brings me to the end of my presentation. Thank you very much again for your attention.